Good day everyone, my name is Alexandr Єременко. This is the first seminar for the course Introduction to the Profession. Today's topic is sensors for measuring blood pressure in small arteries. I've done some research and I would like to share the findings with you. Let's begin. How important it is and how relevant it is. Measuring pressure in small arteries helps detect heart and blood vessel diseases early. Accurate sensors and methods are important for diagnosis and treatment of conditions like hypertension and diabetes-related problems. Modern sensors can be small, wearable, and provide continuous monitoring. This research supports better medical devices and patient care. Aim and objectives. The aim of this work is to examine the types, principles, applications, and problems of small artery microvascular pressure sensors. Objectives: to review the main problems in measuring pressure in small arteries, to explore existing solutions, to explore sensors technologies and experiments, we'll do that, to summarize and compare the findings from different studies. We can say that there are two categories of sensors for measuring blood pressure: non-invasive and invasive sensors. Let's talk first about non-invasive ones. What are they? They are sensors that do not go inside of our body. They are external. They are non-invasive ones. We can say that there are two, so they are on the surface of our skin, not inside. We can say that there are two major types of such sensors. The first one with a difficult name of photoplethysmography sensors. They are known as smartwatches, fitness bands, and fingertip clips. You can see them in the pictures, they're very well known. And the second type, tonometry, or also they are called applanation sensors. They are specialized wrist devices. They're not necessarily used for our wrist, but mostly for wrist. The difference between these two types is that the second type, you need to push the device on your skin, and it seems like you do touch your artery, but actually you don't, because you don't go inside the body. But the second category, invasive sensors, they do go inside our body or a patient's body. The first type, also we can say that there are two major types of these sensors. The first type is catheter tip pressure sensors, microsensors. You can see it in the picture. Basically, it is a sensor with it is a device with a sensor at the tip that goes inside the patient's body, and it catches the blood flow. Then the sensor turns it into an electrical signal, and there is a machine, this white box in the picture, and it shows us the blood pressure in real time. It is very accurate because it is invasive sensor, because these are invasive sensors, and they are very accurate because the sensors are very close to the artery. And the second type is called fluid-filled hydraulic catheter systems. So these devices are basically filled with salt water. The blood flow pushes the water to the sensor, then the sensor turns it into an electrical signal and gives it to the machine. The same idea. But what's the difference? The difference is that this fluid-filled devices, they have a sensor outside the body, not inside the body. They're still invasive sensors because they do go inside our body, but the sensor itself is outside the body. Unlike the first type, catheter tip pressure sensors. The sensor is also, is not also, but the sensor is inside our body, and it is considered more accurate than the fluid-filled type. Let's break down the problems or obstacles of each category. First, non-invasive outside, yeah. First, the cath-based, so usually what we use, what most people use. The cath-based devices are not available to everyone needing frequent measurements. Meaning that when you go out for a walk, when you want to buy some bread, you don't usually take a cath-based device with you. So it is a downside, it is a problem. Accuracy. To measure blood pressure properly with the non-invasive device, you need to have a good device, you need to know the rules, and you need to measure it correctly. And also we have different body types. There are obese people with a lot of fat, and the accuracy is a big problem. 3. A need for trained professionals to measure the pressure accurately, which is something that I've already mentioned. 4. Consistency is also something that I've already mentioned. You can't measure your blood pressure all the time with this method. 5. Anatomical variability, which is something that I've already mentioned. We have different body types. Some people have more fat, and it also has a big impact on the accuracy. Let's look at the invasive sensors and their problems. First, foreign body response, very clear. 2. Long-term stability and drift, children who grow. Basically, what is drift? Drift is a change of something. So, when we have a child and as a patient, and we implant a device, we use a sensors as an implant. But the child grows, and because of the growth, we might have a drift. So the position of the sensor will change, and it is a problem. 3. Power supply and communication, of course. How do you communicate with a device that is inside the body? And how do you power it? 4. The size of the device. It should be very small. And 5. This is actually a problem pointed out by me while doing review and the research. Invasive sensors may cause discomfort and risk for the patients. What I meant by risk was the infections, of course, and discomfort, yes. Next, I've done some review on modern research, and there was a study that showed very well the difference between invasive and non-invasive methods for measuring blood pressure in small arteries. And it showed a lot of interesting things. Let's look at this study. The subjects were ill children between the ages of 1 month to 16 years who were receiving vasoactive drugs. What are vasoactive drugs? They're drugs for their medicines for patients who have problems with blood pressure, whether it is low or high. And basically these medicines, they change the width of the vessel or the artery. It makes it narrower or wider. Both IBP, non-invasive blood pressure, and NIBP, non-invasive blood pressure, were measured at almost the same time using the same monitor. They collected more than 1,000 paired readings, taken within 1 minute. They analyzed how close or different the two measurements were. Aim of the study was to compare invasive blood pressure measurement with non-invasive one. And they found a lot. Let's look at this. The results. When children were in shock, meaning they had low BP, blood pressure, the cuff, remember the cuff, the most known, the most common method of measuring blood pressure, was less accurate and often gave higher readings than the real pressure. Small differences can lead to incorrect treatment decisions, of course. In very sick children who need vasoactive drugs, invasive monitoring is safer and more accurate. The study shows that IBP, invasive blood pressure methods, should be used for unstable patients, while NIBP can be used for screening or stable cases. And so the title of the study was conducted by very smart people in India. The title of the study, Comparison of Invasive Blood Pressure Monitoring versus Non-Invasive Blood Pressure Monitoring in Critically Ill Children Receiving Vasoactive Agents. I think I needed to mention it. You can see in this table, we don't have a lot of time to explore it, but if you do explore it, you can see clearly that the non-invasive method was way less accurate, and it did indeed often give higher measurements than the real pressure, blood pressure. The second table shows the same thing. We don't have a lot of time to explore it, but basically, the higher the blood pressure was, the more non-invasive method was wrong. So what conclusions can we make after reviewing the research? First, measuring blood pressure in small arteries is difficult. It is indeed difficult because the vessels are tiny, pulse changes are fast, tissues around the artery affect readings, especially in obese people. Movement can cause errors. Yeah, you need to know the rules to measure blood pressure. You need to be a professional. And individual physiology varies. Second, invasive sensors can measure pressure directly and accurately, but they have challenges, of course, as well, such as the risk of blood clots and infections, long-term drift, biocompatibility issues, and the need to be very small. 3. Non-invasive sensors are easier to use but can be affected by movement, measure pressure indirectly, and may be less accurate in low blood pressure or critical conditions. 4. Invasive methods. Catheter tip microsensors and fluid-filled arterial lines give high accuracy, real-time readings, and are the gold standard, especially for unstable patients, like we saw in the study. 5. Non-invasive methods. Photoplethysmography is wearable and easy to use but indirect, while tonometry is more precise but must be placed carefully. 6. Cuffless methods allow continuous monitoring but still need calibration and have accuracy limits. 7. Research shows non-invasive sensors work well in stable patients, but invasive monitoring is better for unstable patients or when precise measurement is critical and essential. 8. Choosing the right sensor depends on required accuracy, patient condition, invasiveness tolerance, and artery size, of course. Combining lessons from invasive and non-invasive studies helps develop better small artery sensors that are accurate, continuous, and safe. And I hope that my work was also beneficial and useful. So thank you for listening. If you have any questions, you can write them down below the video.